Thanks very much, Jerry. Time to talk about the latest in health news. And to do that, we are joined by our medical panel of experts. We've got Dr. Srinivas Iyengar, Dr. Landa, and Dr. Carm Sebastian. Good to have you all here.
Great to be here.
Thanks. We are starting things off with aspirin preventing skin cancer. In the largest investigation of its kind, researchers found that women who regularly take aspirin have a decreased risk of developing melanoma, and that the protection may be cumulative because the longer they take it, the lower the risk.
Well, this is really great information for people who are taking aspirin. But again, we have to temper our enthusiasm with the overall results of the study. It's great to know that aspirin may prevent or reduce the incidence of these types of cancer, melanoma being skin cancer. The thought process is that aspirin is an anti-inflammatory agent. So it reduces inflammation in the body, and a lot of cancer may be secondary from inflammation. But the thing is, aspirin can also be a part of peptic ulcer disease or ulcerative diseases in the stomach. So we really have to temper our enthusiasm to say, if you have any history of any GI issues, gastric issues, ulcers, really be careful about saying, well, do the pros outweigh the cons? Do we need to make sure that people who go on aspirin don't have any of those issues first? So that's really important to take home.
And if they don't have those issues, then?
I would suggest for my patients, as a cardiovascular physician, I prescribe 81 milligrams of aspirin to the majority of my patients.
Okay, and at any age?
Well, I would suggest that patients that are over the age of 18, as well, anybody under the age of 18, obviously would defer to the pediatric population for their pediatric physicians. But over the 18, I would say definitely.
All right, interesting. All right, recently we heard news reports about a baby that was cured of HIV. Baby was born to a woman infected and was given heavy doses of drugs. Months later, the baby showed no sign of the virus. Then scientists in France, who followed 14 patients who were treated very swiftly with HIV drugs, but then stopped treatment, found that even when they had been off therapy for more than 7 years, they showed no signs of the virus rebounding. So is this a cure?
You know, Cindy, it's great news for these particular patients, but really what we need to look at, we need to not get so excited about this cure. What we're really doing very aggressively and very well is preventing transmission from mothers to babies. That's really what we're very good at, and we've been doing for a long time, giving doses of antibiotics to the mother, giving them to the baby as a newborn. In this case, this baby just got it as a newborn. But if you give the baby the right medications right away, you can prevent the virus from ever really transmitting to the baby. And so in this case, it's unlikely that the baby ever really had HIV to begin with. So, you know, the miracle of when the baby stopped the drugs, you know, she accidentally, for whatever reason, stopped the drugs, and the baby was found to be negative, the baby was probably never positive to begin with. And so maybe the same thing happened with these adults, because they were treated heavily, swiftly, right away. Maybe the activation of the virus was prevented to begin with.
So to say there's a cure is premature.
I definitely think so.
This is pretty scary. Many women with an ovarian cancer diagnosis are not receiving adequate care or treatments. A study from the University of California found there are major flaws in the care of women who have ovarian cancer. Now, this is really disturbing.
It is disturbing, definitely.
What's the problem here?
You know, the problem is, first of all, it's a hard disease to diagnose, so there's a lot of delay in diagnosis. But then the problem is, once it's diagnosed, it really needs to be sent to a specialist. What the study showed was that most of the ovarian cancer out there is being handled by gynecologists who see very little of it, who do very few ovarian cancer cases a year. And that's really not advantageous for the woman. So what people should do if they get diagnosed with ovarian cancer is they should ask the doctor, are you a specialist in this area? There's an area of specialty called gynecologic oncology. They should be looking for a gynecologic oncologist who sees at least probably 100 cases a year. Those are the doctors who really know how to treat this, and in their hands, the treatment is much more likely to result in a cure or a remission of the cancer than in the hands of a doctor who doesn't see it so often.
And in this case, I think this is one of the times when we say trust and listen to your body, because it's so difficult to say, you know, geez, I think I have ovarian cancer, can you examine me? You get weird symptoms, bloating, abdominal discomfort, and you can't really put your finger on it. So trust your body. If something's not right, keep going and asking until you get that diagnosis.
Okay, and really quickly, should earwax be removed? And how? The popular HBO series Girls had an episode where the lead character punctured her eardrum simply by sticking a Q-tip in her ear canal. That's the grossest thing I've said in a long time. Well, okay, first of all, a Q-tip should not be used to,
okay, well,
to go into the ear.
You know the old adage, don't put anything in your ear besides your elbow. However, you know, I was saying earlier that removal of earwax is very gratifying because when it does get impacted, you know, and you can't hear, once that earwax comes out, it's very, very gratifying to be able to hear again.
How do we get earwax out?
Earwax is important in our ear. I would say you need to see a physician for that. All you do with the Q-tip is use it on the outside of the ear. Do not go into the ear with the Q-tip.
Thank you. If you can't hear, see your physician.
See your physician. Let them do it.
All right, stick around, all right, because we have viewer questions coming up. Super. We'll be right back with more Daytimes. Don't go away.